Hello everyone, my name is Deep Patel. I am going to present an important topic, enhancing Canada's healthcare system by addressing systemic issue and Indigenous health inequalities. This presentation will outline issue and explore ways the system can improve care for Indigenous population. So let's start with the introduction. Indigenous people in Canada face significant health disparities compared to the non-Indigenous population. These disparities affecting life expectancy, chronic disease, and mental health have a deep-rooted roots in systemic issues like colonial policies and ongoing racism. Barriers like inequitable access to healthcare hinder indigenous communities from receiving quality of care. The goal is to address these inequalities by improving healthcare policies, cultural safety, and accessibility for indigenous population. By focusing on equitable and culturally respectful care, Canada's healthcare system can support better health outcomes for Indigenous population. Systemic issues in healthcare delivery for Indigenous patients in Canada include racism and discrimination, lack of access, and inequitable service. Research showed that Indigenous patients often face direct discrimination, subtle biases, and cultural insensitivity within a healthcare system, leading to the feeling of unwelcome and mistrust. Additionally, many Indigenous communities, particularly in remote areas, struggling with limited healthcare infrastructure and forcing patients to travel long distance for essential services. This lack of access contributes to the delay in treatment and worsens health disparities. Addressing this systemic issue is crucial to creating an inclusive and equitable healthcare system that meets the need of all patients. There are several factors contribute to these disparities. Socio-economic challenge like housing instability, food insecurity, and poverty. There is also a historical context. Colonial policies, such as a residential school, have a left-lasting impact. In addition, access is limited in many indigenous communities due to the geographical and resource barrier. Language and cultural barrier also hinder effective communication and care. These factors directly impact health outcomes. Indigenous communities experience significantly higher rates of chronic conditions such as diabetes and heart disease. The social determinant of health, poverty, and lack of culturally appropriate care accelerate these issues, leading to poor physical and mental health outcomes, particularly due to the experience of racism and cultural insensitivity in healthcare. Here is the example of Alberta life expectancy. The graph showed that non-indigenous people have more life expectancy compared to the indigenous population. Strategies for improving healthcare equity include cultural safety training, community-based model, and policy reform. Cultural competence among healthcare providers is vital for communicating effectively with indigenous patients. Empowering indigenous communities to lead healthcare initiatives ensure culturally relevant care. Policy change addressing social determinant and improving access for indigenous people are essential for addressing health inequalities. Prioritizing indigenous leadership and integrating their health need into healthcare framework can lead to better health outcome and more inclusive healthcare system. Based on these strategies, I have few recommendations. First, it is essential to expand mandatory training on indigenous health, culture, and systemic racism within healthcare education. Second, increased financial support is necessary for indigenous and remote health programs. Lastly, fostering partnership between indigenous and non-indigenous healthcare professionals can enhance healthcare delivery and ensure culture sensitivity. Indigenous health inequalities in Canada are rooted in systemic racism, culturally insensitivity, and inequality in social determinant of health. These issues are tied to Canada colonial history, impacting Indigenous communities accessing to and trust in healthcare. To address this, the healthcare system requires systemic change that give priority to cultural safety and the integration of Indigenous knowledge and practices. Healthcare professionals should have access to education and training to work effectively with Indigenous population. The healthcare system must also ensure equitable access to quality of care, actively listening to and incorporating Indigenous voice and need in healthcare policies and practices across the Canada.